Hello, I am Dr. Halfdanarson, one of the medical oncologists at Mayo Clinic, and we have two guests here today to talk about the treatment of pancreatic cancer. We have Dr. Ramesh Ramanathan and Dr. Mitesh Borad. And I would like to start the first question for Dr. Ramanathan. So what would you do in a situation where someone came in with a newly diagnosed pancreatic cancer that was localized but advanced enough so it was impossible to remove with surgery? Is there anything that can be done to shrink these tumors down before we go into surgery?
So the best treatment for pancreatic cancer, like all other cancers, is surgery if it's possible to do it. So in some cases, after we do a thorough evaluation of the cancer, which requires usually CAT scans, endoscopic ultrasounds, and we find that the cancer cannot be removed by surgery safely. In that situation, we would look at other treatment options, including chemotherapy or chemotherapy and radiation. So the goal obviously would be try and shrink the cancer, and especially in a category called borderline resectable, where it's still surgery may be possible. That's what we would look for. And we certainly have a number of new clinical trials looking at this situation, adding new drugs to standard chemotherapy.
So the next question is for you, Dr. Borad. What needs to be done after surgery in terms of chemotherapy?
Yeah, so it's known that after surgery, if nothing is done, the chance of the cancer coming back is quite high because there may be, as they say, microscopic disease, just cells that you cannot see that are visible, that are present, and these need to be eradicated to give a good long-term outcome. So the options that are available are chemotherapy, and sometimes chemotherapy followed by chemotherapy and radiation, or different combinations using these two tools. And that can go on for a period anywhere from 6 to 9 months in total.
Excellent. And for you, Dr. Ramanathan, so what can you tell us about the advances in the management of advanced or metastatic pancreatic cancer? Are there any recent advances that you would like to share with us?
Well, in the last few years, there's been a number of advances. For advanced pancreatic cancer, the mainstay of treatment has been a drug called gemcitabine, which we have had for the last 15 years. But recently, based on clinical trials, two new drugs, a regimen called FOLFIRINOX and a new drug called nab-paclitaxel, have been added to or used in place of gemcitabine. So that has certainly shown an improvement in the efficacy and in the outcome of patients. But that is still an incremental improvement. Typically with these new chemotherapy drugs, we do see patients surviving for almost 2 years, but obviously we want to see results much better than that. So what we are working on, as well as other centers in the country, is looking at clinical trials and looking at adding new drugs to standard chemotherapy, and also looking at the molecular profile of tumors to see if we can actually target those abnormalities.
So, Dr. Borad, tell me a little bit about the clinical trial efforts ongoing at the Mayo Clinic for pancreatic cancer.
Yeah, so clinical trials play a very vital role in the management of pancreatic cancer when it's advanced. And as Dr. Ramanathan alluded to, the drugs we are using currently were in clinical trials just a few years ago. So these take different approaches, whether it's using the immune system or targeting cancer stem cells or DNA repair pathways. So using sort of these various themes at any given time, sort of an array of clinical trials are available at institutions like Mayo Clinic and other centers, and we would encourage patients to actively seek these out to try to improve their chances of getting a good outcome.
So for you, Dr. Ramanathan, we are hearing a lot about the molecular profiling of patients with cancer. How do you see that fit in the management of pancreatic cancer?
Molecular profiling refers to a number of different techniques where you are able to analyze the molecular structure of cancers. So we know that most cancers have a lot of abnormality in genes and what we call mutations in genes, and they can range from 50 mutations to a few hundred mutations. So at Mayo Clinic and as well as other places, there are a number of techniques, including whole genome sequencing, which refers to looking at every single gene in the cancer cell compared to a normal cell, as well as other techniques where we can look at certain relevant genes in cancer. So one of the programs that we are doing is to look at abnormal genes and to see whether there is a drug which can affect that gene. So this is what we call targeted therapy. So there are a number of clinical trials. This is certainly not standard therapy in most cases. We have a number of clinical trials looking to see if we can individualize therapy for patients with pancreatic cancer.
So, Dr. Borad, what would be the best way for a patient interested in clinical trials to get involved?
I think there are a number of avenues. We've seen that generally the patient's own physician is a very good source of information, and of course reaching out to centers that do a lot of this type of work and have expertise in it is another great avenue. So we would encourage patients wherever they are to try to seek out a center where they are focused on cancers like pancreatic cancer, and that's where a lot of these trials will reside.
Thank you very much for an excellent discussion. I hope you found this information useful, and if you have further questions, I would like to direct you to the Mayo Clinic website.